what I will do is, this is the stem cells in PRP. It'll go in the joint. I will actually unscrew it, put the ozone in, so it's only one shot. Okay?
Please.
Yeah. I always clean after the pre-ethyl, post-ethyl. Remember, none of this is sterile. It's the best you could do. I never had a joint infection in my career of injecting joints for 14 years. Whatever makes you happy. Makes you happy. This is the big thing about ozone. Don't have this on so tight like you're used to.
And you can't.
You cannot get the dang thing off without, especially when they're like bone on bone. It's not so fun.
Yeah.
For them. Okay?
Yep.
Awesome.
So, Doc, what are these cells doing?
All right, so basically the stem cells are going to home in on all of the areas of inflammation. They're called beacons, all right, and homing signals, and they're going to find these areas of inflammation, ligaments, muscles, and essentially heal them, okay? They're going to release exosomes, they're going to bring in cytokines, white blood cells, leukotrienes into the area to help heal that. They're also going to increase collagen production. So what we're going to do is we're going to initially elicit inflammation, and then we're going to reduce inflammation. So we're healing and creating new stem cells and healing the old stem cells. And then we're also going to be reducing inflammation in the long run. And that whole process takes anywhere from about 10 days up to 6 months.
Okay.
So I always tell people that if you're going to get another injection of stem cells, wait the 3 to 6 months and let it do its thing. But for the vast majority of patients, what I'll do is I'll actually do ozone or PRP again, just because it's really cost effective and a lot of times it's enough. But the benefit of PRP with the stem cells is we're giving it the scaffolding to stay in the knee so that it doesn't diffuse everywhere, okay? We want it when we do it intravenous to infuse everywhere. But for the knee, I want it to stay as localized as it can, and that's what the PRP is going to do. It's going to give it that scaffolding, okay? The ozone, what that's going to do is...
Which is what you just put in after.
Correct, the gas.
Yep.
So the ozone is O3. It's oxygen plus an extra, it's O2, oxygen gas plus another oxygen molecule. What that's going to do is oxygenate the area. So the vast majority of our problem when we have joint problems or muscle problems or trigger point injection or trigger point tenderness is that it's starved of oxygen. There's been such chronic inflammation and stiffness in there that those ligaments and joints and muscles start to get tight, and when that happens, it's constricting blood flow to the area. Okay. So if we can oxygenate that area, we're going to feed the stem cells, feed the PRP. Okay, so we're one of the only places that actually gives you all three at the same time, because the data really says that you should. It really says that you need to give the stem cells the food, but you also need to give them the oxygen. Otherwise, it takes longer for it to heal. So basically, we're giving the stem cells everything that it needs to go in and repair. Your body's having to work a lot less hard to get the area to repair. Okay. Not to mention, every decade we're losing stem cells. We're lacking oxygen to those areas because it's getting tighter. We're losing the growth factors. Okay. So everything we can get that expensive stem cell to work better and faster and make your body not work as hard.
So I've got an inverter table.
Yes.
Should I get on the inverter table every now and then, try to spread my joints?
Absolutely. Could be good. What I will tell you is that for the next 7 to 10 days, you're going to baby these. Okay. These are little babies right now. You want to help the stem cells do what they need to do. You actually can feel more inflammation initially because we are eliciting an inflammatory response. We're asking cytokines and leukotrienes and white blood cells, all these things that come in when we have an infection, to actually come in and try to heal. When we're healing, we actually can feel more inflammation at that time. A lot of people don't. I just want you to know that if you do feel that, it's normal. Almost nobody feels that when we also give the PRP and the ozone, okay? But just know that can be normal. One rule, other than baby these for 10 to 14 days, no anti-inflammatories for 2 weeks. Because remember, we're eliciting inflammation initially. So no Aleve, no aspirin unless your doctor says you have to have it for your heart. No ibuprofen, nothing like that. You can have Tylenol. Absolutely, you can have Tylenol. And I also say don't heat or ice because that changes the inflammatory properties. Just do Tylenol, okay? And since we did the ozone, a little bit of light physical therapy, right? And what I mean is what we're going to do right now is just extend. Yep, and flex. And extend. And flex. Good job. You kind of hear that sloshing around in there? It's crazy, right? Can you hear that?
Yeah.
Pretty cool. Okay.